All right, Mr. 6 seconds. Ahead of the State of the Union address, President Bush is out with a new health care plan aimed at expanding coverage through tax credits. It's aimed to make health care coverage a free market, but the cost here, well, that's paid for money that would have gone into your care and maybe into your pocket, too. So are you still interested in this? Joining us right now are Diana Furchtgott-Roth of the Hudson Institute and Karen Davenport, the Director of Health Policy at the Center for American Progress. And Karen, let me start things off with you. This plan, will it make more people have health insurance?
We don't think so. It looks to us like this plan will actually do very little for the uninsured. It will provide people with new tax deductions for their health insurance, but given that they'll have to buy that coverage in the individual market, which doesn't work very well, we don't think there's going to be a big difference in the uninsured.
Diana, what do you think?
Well, I think it's a revolutionary plan. It levels the playing field for the first time between the 47 million uninsured and those who have employer-provided health insurance.
Diana,
the president is saying to the 47 million uninsured, I'm giving you $4,500 to choose your own health plan and buy it. Choose your own doctor, choose your own plan, and no one has ever said that to them before.
Although, Diana, this is also really taking a look at the middle class and potentially raising the taxes that they're going to be paying, correct?
Not at all, because people who have health insurance are also going to be getting that same tax break.
Beyond a certain limit, beyond a certain level, if you have enough health care insurance, you would be paying taxes on benefits that you haven't been paying taxes on to this point.
If you have a really expensive plan, and that's about 20% of the plans out there, you will receive an increase. But it's fair to the 47 million uninsured that they get the same tax break as people who've had employer-provided health insurance. And up to now, they have not had this tax break. This would give them that same tax break.
I guess I keep hearing this referred to as a free market model, and I'm a little confused by that because you're still talking about subsidies and not necessarily an equal playing field for everyone.
Oh, no, that's not true. Everybody would get the same $4,500 to go shopping, and they could pick whatever plan they want, just as they can pick whatever auto insurance they want or home insurance they want. And there would be a variety of plans. Someone who wanted a bare-bones plan could take that and keep the rest of the $4,500. Someone who wanted a more expensive plan could use all the $4,500 and spend a little bit more. So we give everybody choice. They could choose their own doctors. They could choose their own plans, and that's what everybody wants to do.
Karen, that doesn't sound like such a bad deal. Why are businesses so opposed to this?
Well, for businesses, it's going to mean, actually, they could, we'll see how they respond, but they could end up reducing the benefits that they provide their employees. It also means that for businesses and for their employees who are in high-cost areas or businesses that are in a sector of the economy where they may have older or sicker workers, that their employees are going to see less of a tax benefit. It may actually end up paying more in taxes because they're getting health insurance that's quite expensive. And I think that this doesn't necessarily do much for the cost pressures that businesses are facing as they're struggling to provide health insurance to their employees.
Diana, let's go back to that point. If I live in an area where it costs a lot of money to get health care insurance, and now I'm going to be taxed on anything over that $4,000 and something limit, what do you say to that? Yes, I am going to be paying more in taxes.
Well, what I think is here everyone is saying that President Bush is doing is hurting businesses. Before, everyone was saying President Bush was helping businesses and doing too much for business. Now he tries to do something to the 47 million uninsured, and people say, oh, he's hurting businesses. What's really going to happen is that people are going to have an incentive to provide the best health plan possible. Those who have too expensive health plans now are going to have to pay a portion of that, but everybody is going to have the opportunity to get health insurance.
Diana, labor unions are opposed to this because they say one of the few things we can count on are our health care benefits. What do you say to that?
Well, what unions want to have is universal health service where the government provides everything, where there's one plan for everybody, but Americans want to choose. They want to choose their plan.
But I thought you just said we'd all have the same
doctor.
thing, right? We'd all have the same coverage under this plan?
Everybody can get to choose their plan. Everyone can get to choose a $3,500 or a $4,500 plan, whatever kind of plan they want. And if they want a more expensive plan, they pay more than the $4,500.
Karen, last word on this. When we start talking about health care coverage in the past, this has really been a lightning rod for all sorts of criticisms, for all sorts of debates. Do you think something like this could get passed through the House?
I don't think that this plan can get passed through the House, but I think there's a lot of interest both within Congress and certainly among groups and employers and employees outside of Congress to do something about health care and particularly about the 47 million uninsured and health care costs as well. I don't think this plan I think it's inadequate for both the uninsured and for people who have coverage right now, and it's not going to work. So I don't think it's going to get through Congress.
All right, Diana, Karen, thank you both for your time. Appreciate it.
Thank you.
Thank you, Becky.
All right, let's get to Mark Haynes at the New York Stock Exchange. We'll look at what's coming up on today's Squawk on the Street. Good morning, Mark.
Good morning, Joe. Have a nice time in warm and sunny California.
I know. We were just talking about global warming. I said, tell that to the orange growers out there, right?
Yeah. All right. You guys have been waiting through the wave of earnings, so slice and dice the numbers, see what it means for your money before the bell. 5 new ETFs hitting the street today, and they're all focused on your health. One on your heart, one on cancer. The list goes on. We'll ask the CEO why this is a good investing idea. And get ready for takeoff. Airlines a top sector this year. Should you spread your wings and fly into those stocks? Squawk on the Street coming up in 11 minutes, Joe.
Yeah, just about exactly. 11 minutes and 5 seconds. Oh, 4, 3, go. It never works for me, Mark. It keeps changing. Thank you. Next, the business of Hollywood.